Have you ever felt like this? At night, you're sleeping soundly when suddenly you wake up because you need to pee. You sit down on the toilet, the urine just starts to flow, and that burning, stinging, prickling pain appears. Every trip to the bathroom feels uncomfortable, even haunting. Many people in middle age think, it's probably just because I don't drink enough water, or it's because the weather is too hot. But behind painful urination, there could be infection, stones, enlarged prostate. And sometimes it's a sign of more serious diseases. In this video, we're going to explore what painful urination actually is, the common causes in middle age, which warning signs mean you should see a doctor immediately, and especially simple daily prevention and self-care tips that anyone can do at home. A small note, this video is for educational purposes only and does not replace a doctor's diagnosis or prescription. If you are in severe pain, have a fever, or see blood in your urine, please go to the clinic or hospital as soon as possible. Before we go into the details, we need to understand one important thing. Urinary problems such as painful urination, frequent urination, and needing to pee at night are extremely common. Across the world, there are hundreds of millions of urinary tract infection cases each year, and this is considered one of the most common bacterial infections in adults. In women, statistics show that half of all women will experience at least one urinary tract infection in their lifetime. For men, once they pass the age of 50, the rate of prostate problems rises significantly, leading to symptoms such as difficulty urinating, a weak urine stream, going to the bathroom many times, and in quite a few cases, painful urination as well. That means if you're in your 40s, 50s, or older, and you notice that you need to pee more often, feel burning or pain when you pee, then you are not alone. However, common does not mean normal or something you can just ignore. In middle age, our bodies have gone through many changes, hormones, immunity, and underlying conditions such as diabetes and high blood pressure. That's why understanding things correctly, preventing problems properly, and taking care of yourself the right way is very important to avoid complications in the kidneys, bladder, or other serious diseases. So, what exactly is painful urination? In medical terms, painful urination is called dysuria, meaning a burning, stinging, or hot sensation when you pee. This feeling may appear right when the urine stream starts, or become more intense toward the end of urination. And sometimes the burning sensation can linger for a while, even after you've finished. Mechanism-wise, you can imagine it like this. The lining inside the bladder and urethra is like a thin, soft layer of skin. When it becomes inflamed, scratched, or irritated, that area turns sensitive, just like when your skin is scraped. At that point, every time urine passes through, especially when the urine is concentrated and dark, it's like pouring salty water onto a fresh scratch, very sore and uncomfortable. That is the burning, stinging sensation while peeing that many people experience. Usually, painful urination doesn't come alone. It often goes together with other symptoms such as frequent urination, feeling the urge to pee many times a day, but only a small amount each time. Urgency, suddenly feeling a very strong need to pee and having to go immediately. Cloudy urine, foul-smelling urine, or sometimes blood in the urine. A feeling of heaviness, fullness in the lower abdomen, or pain in the flank or lower back. The important thing to remember is, painful urination is not a disease. It is a symptom, and one single symptom can appear in many different conditions of the urinary system. Why are we more likely to have painful urination in middle age? There are a few common groups of causes that affect both men and women. First cause, urinary tract infection. This is the most common cause. Bacteria from the genital or anal area can travel up into the urethra, then into the bladder, causing inflammation. When the bladder is inflamed, urination becomes burning and painful, with frequent small amounts of urine, and sometimes the urine is cloudy and foul-smelling. Second cause, urinary stones. Stones can be located in the kidneys, ureters, or bladder. When stones rub against the lining of the urinary tract or get stuck in narrow areas, the person may have back pain or pain on one side of the flank, experience painful urination or blood in the urine, have episodes of severe cramping pain that are very uncomfortable. Third cause, overactive or irritable bladder. Some people don't necessarily have an infection, but their bladder is more sensitive than normal. This leads to symptoms like urgent need to urinate, frequent urination, difficulty holding urine, and sometimes a mild burning sensation. Fourth cause, sexually transmitted infections. Certain conditions such as gonorrhea, chlamydia, and genital herpes can cause marked painful urination, along with abnormal discharge, itching, and pain during intercourse. All of these groups of causes can occur in people in their 30s, 40s, 50s, and older. For middle-aged men, there are two very characteristic factors. First is benign prostatic hyperplasia. The prostate gland sits just below the bladder and surrounds the first part of the urethra. After the age of 50, this gland tends to enlarge. Like a ring tightening around the urine tube gut. As a result, men may experience difficulty starting urination, needing to strain to pee, a weak or intermittent urine stream, waking up many times at night to urinate, a feeling of not emptying the bladder completely after peeing, when urine stays in the bladder for a long time. Bacteria can grow more easily, is leading to infection and painful urination. Second is prostatitis, inflammation of the prostate. Men may notice burning or stinging when urinating, pain in the area between the scrotum and the anus, pain when sitting for a long time, sometimes accompanied by fever and fatigue. These two issues make middle-aged men particularly prone to uncomfortable urinary symptoms. In middle-aged women, especially during the perimenopausal and menopausal stages, the causes are a bit different. When estrogen levels drop, the lining of the vagina and urethra becomes thinner, drier, and more easily damaged. This leads to a higher risk of vaginitis and urethritis, a higher risk of bladder infections, which in turn causes burning or stinging when urinating or during intercourse. In addition, some women develop pelvic organ prolapse, such as bladder prolapse or uterine prolapse, which changes the structure of the pelvic area, leading to difficulty urinating, urinary leakage, increased risk of urinary tract infections, and a general feeling of discomfort in the lower abdomen. All of these changes are a normal part of aging, but persistent burning or pain when urinating should not be ignored. Not every case of painful urination is dangerous, but there are some red flag signs you should absolutely not ignore. First, painful urination accompanied by fever, chills, and extreme tiredness. This may mean the infection is not just in the bladder anymore, but has spread up to the kidneys or more widely through the body. It is especially dangerous in people with diabetes, kidney failure, or weakened immunity. Second, blood in the urine. Your urine may look pink, red, or brown, or your doctor may detect a large number of red blood cells in a urine test. The cause might be stones or severe inflammation, but it can also be bladder cancer or cancer of the urinary tract, especially in people who have smoked for many years or been exposed to chemicals. Third, severe back or flank pain, along with nausea and vomiting. This may be a sign of a ureteral stone causing obstruction, which needs early treatment to prevent kidney damage. Fourth, urinary retention, feeling the urge to pee but being unable to pass urine. The lower abdomen feels tight and very uncomfortable. This may be a complication of an enlarged prostate or a stone blocking the flow. This is an emergency situation, and you should not delay. Fifth, painful or difficult urination that lasts for many weeks, together with weight loss and fatigue. In this case, you need a thorough examination by a doctor to rule out chronic diseases or early-stage cancer. If you or a loved one has any of the warning signs above, do not self-diagnose and do not buy medication on your own. Please go and see a doctor as soon as possible. The good news is, there are many very simple things we can do every day to reduce the risk of painful urination, urinary tract infections, and other urinary problems. Habit number 1, drink enough water. For people who are not on fluid restriction due to heart or kidney disease, the suggested amount is about 1.5 to 2 liters of water per day. Drink it evenly throughout the day. Can avoid drinking too much in the evening to reduce nighttime urination. Water helps flush out bacteria from the bladder and makes the urine less concentrated, so it causes less burning. Habit number 2, don't hold your urine for too long. When your bladder is already full, but you keep holding it in, the retained urine becomes an ideal environment for bacteria to grow. If this habit is repeated over time, it increases the risk of bladder infection and painful urination. Habit number 3, clean the genital area properly. For women, wipe from front to back to reduce the risk of dragging bacteria from the anus toward the urethra. Avoid deep douching and do not use strong cleansing solutions every day. For men, clean the glans penis daily, especially if you are uncircumcised. Habit number 4, practice safe sex. Use condoms when needed to reduce the risk of sexually transmitted infections. It's also helpful to urinate after intercourse to flush out bacteria that may have entered the urethra. Habit number 5, control underlying health conditions. Diabetes, obesity, high blood pressure, and high cholesterol all make the body more prone to infections and slower to heal. Keeping your blood sugar stable, maintaining a healthy weight, and getting regular health checkups will help protect both your kidneys and your bladder. Habit number 6, limit bladder irritants. Coffee, strong tea, sugary carbonated drinks, alcohol, and very spicy foods can make the bladder more sensitive, causing urgency, frequent urination, and discomfort. If you cut back on these, you'll find that your urinary system feels much more comfortable. If one day you start to feel a bit of burning or stinging when you pee, but it's not too bad yet, there are a few gentle measures you can try in the first 1 to 2 days while you're waiting to see a doctor. Things you should do: slightly increase your water intake, spread out over the whole day. Keep the genital area clean and dry. Change your underwear if it gets damp. Wear loose, breathable clothing and avoid tight clothes for long periods. You can apply a warm compress to the lower abdomen to ease the feeling of bladder pressure. Rest, get enough sleep, and try not to stay up too late. Things you should not do. Don't buy antibiotics on your own just because someone recommended them or because they worked last time. Different bacteria are sensitive to different groups of antibiotics. Using the wrong drug or not taking enough can lead to antibiotic resistance, making the infection more stubborn and harder to treat. Don't use painkillers or herbal remedies of unknown origin for a long time without knowing what condition you actually have. Don't hold your urine out of fear of pain. The longer you hold it, the more the bladder stretches and the more uncomfortable it becomes. If after 2 to 3 days you've been drinking enough water, resting, and maintaining good hygiene, but you still have no improvement in the burning or pain when urinating, or the symptoms keep coming back again and again, or you start to develop fever, cloudy urine, blood in the urine, or back pain, then that's the time you should go to a medical facility to get checked. Usually, the doctor only needs to ask about your symptoms, do a urine test, and perform an ultrasound of the kidneys, bladder, and prostate to already have a fairly clear idea of the cause. This is often quicker and less costly than guessing on your own and taking multiple rounds of self-prescribed medication. In summary, painful urination is a very common symptom in middle age. It may come from simple issues like a mild urinary tract infection, but sometimes it's also a warning signal of stones, kidney damage, or even cancer. Understanding the common causes, recognizing the danger signs early, and maintaining good daily habits will help you protect your urinary tract, your kidney function, and your overall quality of life. If you found this video helpful, please hit like, subscribe to the channel, and share it with your family and friends in their 40s, 50s, and 60s. Who knows? Just one small video might help someone detect a disease earlier. Thank you for watching until the end. See you again in the next health topics.